to invite up Aranka Hetyey. Aranka is the head of digital enablers at Save the Children International, where she, together with the digital enablers team, she ensures Save the Children has the right suite of digital tools to transform their impact for children. Before joining Save the Children International, Aranka spent the last 3.5 years at Amref Flying Doctors in the role of venture manager, responsible for developing, testing, and scaling financially sustainable health solutions in Eastern African countries. Save the Children has the ambition to inspire 3 specific breakthroughs for children by 2030. Survive, no child dies from preventable causes before their 5th birthday. Learn, all children learn from quality basic education. Be protected. Violence against children is no longer tolerated. By making the shift to outcome-driven measurement of impact, standardizing outcome metrics, data collection tools, and analytics dashboards, Save the Children wants to save time for country office staff, create outcome-focused cultural shift, and use data to make better decisions. However, streamlining data collection, aggregation, and reporting across 60 country offices and 115 countries of implementation isn't an easy task. Welcome, Aranka, whose keynote highlights the approach to standardization, key challenges, achievements, and shaping the desired future for Save the Children. Thank you.
Can you hear me all okay? Yeah, I have many mics and apparently not the right shirt to wear mics. I hope everything stays on. Thanks for this introduction. I think you actually captured my first few slides there, so that's amazing. So I won't try to repeat too much. But yeah, I very proudly work at Save the Children. I'm very new to my role, so I joined the organization about 8 months ago. And I recognize a lot of the challenges that you've been talking about. And interestingly, some of the questions that came up at the end is actually the stuff I work on quite a lot. So this next presentation will be much more about kind of that data collection aspect of analytics and really understanding as a global organization, working in many different countries with in many different contexts and also many different kind of emergency versus more development work. How can we standardize, streamline the way that we collect our data so that the data is of high quality, and ultimately, hopefully, can be consolidated across our country offices so that we can really start to understand whether the interventions that we bring also achieve the outcomes that we hope to achieve. So very shortly about Save the Children. So we have 3 main goals. I won't repeat them because they've just been mentioned. I think it's good to understand kind of the scope of our operations, and I think that's also one of the reasons it's quite complex to gather high quality data. So we're working across 113 countries with 25,000 staff. Of course, not all staff is working on data, luckily, but quite some are. And what we also see in our context is a very high attrition. So this could be due to the context that people are working in. So imagine working in the Gaza Stroke, working in Ukraine. It's a very high pressure environment that you're working in. So what we see is there's a high retention of staff leaving, including the staff working on these topics. And I think that's one of the reasons it makes it complex. Also, within Save the Children, we are working across 5 kind of thematic areas. So from child poverty to health nutrition to education, and kind of this wide breadth of teams that we're working on also makes it quite complex, especially given the different projects that our teams are working on often consist of multiple sectors. So there might be some projects working on nutrition and education, some projects working on poverty and health, and being able to then still have straightforward, fairly standard data collection templates to be used in the field is quite difficult. I'll expand on that more later. So why global outcome indicators? So one of the important shifts that we're making in Save the Children is instead of just reporting on our output indicators, so meaning how many teachers did we train, we're increasingly shifting our focus to more outcome-based indicators. So what's actually the improvement of the knowledge levels of teachers or of the children in their classrooms based on the activities that we provided them. And well, I just mentioned kind of the scale of our operations. Currently, we did an assessment and we are measuring our impact, so whether that's outcome or output indicators, in 6,000 different ways. And of course, this is not very efficient. It also provides a lot of challenge where you want to start to consolidate and aggregate the data at a global level and really being able to provide kind of standardized dashboards to consume that data. So it was very clear to us that we needed to improve this situation. However, there's on the one hand the opportunity of standardization that sometimes seems to go across the need for localization and contextualization. So localization in this context is that increasingly as an organization, we're working with local partners to implement our projects. So that means that they are doing a lot of the implementation activities instead of us. Contextualization sometimes means language, sometimes means just a slightly different way of asking the same question so that you're culturally sensitive. When we look at standardization, on the one hand, this is a technical challenge, right? So how do we provide a tool that's easy to use in countries that have kind of different digital literacy? It's also very much a kind of a human-based challenge because people have been working for a certain way for a very long time, which often means if you start a project, you design your log frame, so you design how you're going to measure your impact, and that's often partially based on the interventions that you're doing. It's also based on what the donor would like to see. And this is not a nice reality, but it is still a reality that we live in. So we're trying to shift that. We're trying to align what we measure with what the donor would like to see. But we also want to provide kind of the freedom and the liberty of the field teams that really understand what's needed in local context to adjust their approach if they see that what they're currently doing isn't working or the needs are changing as the project progresses. So one thing that we have done at Save the Children is common approaches. So common approaches are common ways, evidence-based ways to deliver our projects. So those kind of templates come with a lot of information for the implementing teams in the countries of how to best deliver, for example, cash transfer projects. So they come with standardized ways to measure your impact. They come with standardized interventions, questionnaires, tools. So I think this is really a step into the right direction. But definitely it's also a journey that we're on. So we started this journey a few years ago, 2020. And you see a very gradual uptake of common approaches in new projects. So we're around kind of the 70 or 65% of common approaches being used in new proposals. So that means when we ingrain those common approaches at a very early phase of the project, so at fundraising, then we can kind of throughout project delivery, we can follow that common approach and we can follow also the templates that are linked to that common approach. To make it a bit more practical, and also because I've heard people like numbers, what does it look like in Save the Children? So let me just start with the 11K. So the 11K is the forms that are created to collect data. So what I'm talking about when I say data collection is that some of you might already know this, but within our projects, we have at very set intervals, we need to collect data. So for example, at the beginning of the project, let's say there was an earthquake, we need to understand what are the needs of the local population at this point in time. Do they need water? Do they need shelter? Medical kits? So what we do is our data collectors, they go into the communities that were hit, and they will ask them, what do you need? And when do you need it? And how can we best help you? And you can imagine that each time something happens, a disaster strikes, that people might reinvent those forms. So again, they're going to think about what do we need to ask in order to inventorize those needs. What we are now pushing towards is having standardized forms for rapid needs assessments with standard tools. So COBO was also mentioned by you, Rolf. So it's a very common tool that works offline. So when you don't have internet, you use it on your mobile phone. And this will allow our teams in the field to be much quicker in collecting the data they need. If we can then bring that together with kind of standardized dashboards that help to visualize the data for different teams working with the data, this means that we can be much quicker to offer kind of relevant support to program participants. Where we are not yet is that we have those forms for all the topics that we work on. And so what you see in the 11K, that means that every time someone wants to collect data, they started a new form. And this is since, I think, the last 1.5, 2 years. Last year, we had around 1,000 projects. So you can imagine how often forms are created. So I really think we can make a very big step in improving this. We have started this. So the 40 quality assured forms are basically the forms that we have available in the library for country offices to access based on the expertise of our technical experts in the specific domains that they're working on. So they're really of high quality. 3.9 entries submitted. So that means the forms submitted since we started. 50 plus partner organizations using our Kobo. So that means partner organizations are whitelisted on our domains. They can access the forms as well. So that will really help to streamline kind of the collaboration between us and our partners, and 900 accounts. So back to the global indicators. So as I mentioned, we want to make a shift from output indicators to more outcome indicators. This will help us to really understand where we can improve the way that we deliver our work. By having those global outcome indicators standardized, we hope to save time for our country staff. We want to drive really a cultural shift. So really starting to think not which activity do I need to complete or how many hours do I need to burn, but much more, how can I achieve the impact that I want to achieve? So if that means that you're in a project and midway you need to adjust your course to still hit your outcome indicator, that would be fine. That's even encouraged. And lastly, we want to use our data more effectively also to tell our impact story. So if you think of like what could be such an outcome indicator, so here are a few. I think one that I like to call out. We will dive in a little bit deeper, as well as the percentages of children who experience any physical punishment and or psychological aggression by caregivers in the past month. So you can imagine there's many ways to improve this, but this is kind of the global outcome indicator that we ask all country offices, so all 60 of them, to report on. That can really help us to start understanding the impact that we have. And it's a very different metric from kind of the typical reach metric that's used, like how many people did we reach, which is, it's great that you reach many people, but if you don't achieve the change that you want to see, the value is really a lot less. So in a nutshell, how do we connect the data collection to the advanced analytics? In the top right is that if we capture data consistently, accurately, in a standardized way that allows for better analysis, then we can see like how do we need to change our way of working to achieve the impact that we want to achieve. So back to the example. This is a bit practical, but for me it always helps to bring it to life a little bit. So one of the indicators that we've recently launched is the adult attitude towards physical and humiliating punishment. So what have we done? We've created a website. It's called IndiKit. You can access it after this conference. You can see all the indicators that we're reporting on. But in the IndiKit, we link to the Kobo form. So this is really a very practical form that contains all the questions that are relevant for this indicator. We refer people to, you need to answer question 1 and 2. And if you do that, then we can calculate the indicator for you. So it should make it as easy as possible for people to report on those global indicators and to start using that data. And this is what the form looks like, and they can use it on their mobile phone, and country offices can kind of consolidate, combine different forms, because like I mentioned, if you are working in a project and you're doing both something about poverty and education, you can combine the different indicators. Our journey, well, the Big Bang or the starting from scratch, I think it's very similar within the Save the Children. So I just took it from 2021. And this is when the initial rollout of the indicators, global indicators, started. And for some reason, we ended up with 200 indicators that were barely used. So safe to say that didn't go as we had planned. I think partially it had to do with the indicators being way too complex, not easy to measure. having no clear process around how to use the indicators, not providing standard tools to gather data for the indicators. So I think a lot of lessons learned, and also very clear shared view across the organization. This is something that we want to do, that we need to do, but that we definitely need to do in a different way than how we started it. So kind of fast forward to where we are now, is that what we did is we started to, when we first started, we didn't have a data and analytics department at all. So that one was set up, I think 2 years ago. So 1.5 years ago, the director of data analytics, Roy, who also helped to prepare this presentation, really started to look at, okay, what are the kind of things that we want to do in the data, to kind of then work way backwards into, like, what do we then need in terms of infrastructure, in terms of skills, in terms of the data that we collect, to be able to do those analysis. And I think, like, within Save the Children, there's many pockets and really great examples of how data is being used. So recently I was in Turkey and I saw they created a dashboard to keep track of the feedback that was provided by children on the programs that they delivered. And it's a really great example. So what we are really looking at in the kind of the global team is, how can we scale that? How can we make it scalable so that we also make it easy for those country offices that maybe are small, that don't have the capacity or the availability of resources to invest in capacity, but to still be able to kind of make use of the data that they are collecting anyways. Because in all of our projects, we're collecting so much data that's currently not being used to the extent that is possible. And I think that's really a missed opportunity, and something that we want to improve by kind of going on this global indicators journey. Kobo was mentioned. How many of you know Kobo? Just, yeah. Yeah, it's definitely one of the most used tools in our sector. It's really a great tool for what we call one-off data collection. So that means, like, you don't need to track someone over time, but you just want to know at this point in time, what are your needs, or at this point in time, what is your access to health facilities, for examples. So we use it for, well, like I said, like needs assessments, training attendees, evaluations. And Kobo used to be a free tool. This was great, but also came with kind of a downside, because it meant that people often use their personal email addresses to sign up to Kobo, because they need to quickly create an account so that they can make a survey, so that they can collect the data. It's fast, it's free, that's great. But what it doesn't allow us is to have that data centralized, to be able to consume it, but also to be able to revoke access to sensitive data at a point in time that, for example, someone leaves the organization. So what we've done with Kobo is that we've created a kind of a private or a centralized version or instance of Kobo, which means that we can have much more control on user access, on data privacy and security. And we can also offer a support model to our country offices in using Kobo. So, I mean, I won't read out all the advantages, but what is really appreciated by our country offices is that they can get the support, they feel much more secure and confident about the data protection. So within a year's time, I think it was last year, we were able to onboard 60 country offices onto Kobo, which was, I think, really a great achievement in itself. But definitely we're not there yet, because now that all the country offices are on Kobo, on the instance of Kobo, now we really need to start pushing to start using those standardized forms, using kind of the data collection for outcome indicators. So just to recap, key challenges: the uptake of standardized forms, being able to consolidate, simplify forms across different thematic areas, so that also for kind of those multi-sector projects, you're still able to collect high quality data, being able to manage those forms centrally to provide a good user experience for using the forms. And I think those are kind of the things that me and the team are currently working on and trying to understand, like, how can we improve that. So that's that. Then one thing that I haven't gone into, because it's maybe a bit technical, too much. I would take too much time. But one thing we're also looking into is more longitudinal data collection. So that's if you want to track someone over time. For this, you need a different tool. And what we're investigating is, do we want to have one tool or multiple tools to do kind of the one-off and the longitudinal data collection? So that's one thing that we're currently also looking at. But yeah, I already mentioned we're also doing quite cool stuff. the teenage sex, I guess, that was talked about earlier, which is using AI or machine learning. And I just briefly want to show you one of the use cases that my colleagues have been working on, which is the microestimates of multidimensional child poverty in the sub-Saharan African context. So about 1 billion children live in multidimensional poverty. So that could be in health, in education, housing, water, for example. And the estimates to understand where those children live are often based on what they call household surveys. So national surveys that are conducted maybe once every few years that provide some indication of where what poverty level is, but it's at a very high level. So it's kind of at a, not even at the city level sometimes, but the level above, so at the district level. So exactly knowing where those children are that are living in poverty is quite hard to understand. So what we need is a much more granular picture of poverty. So to really understand, how do we target those that need it most? So what we have done is we've created kind of a machine learning model where we use different sources of data to inform where children in poverty are living, and also what the dimensions of poverty are that they are dealing with. So what we used are satellite images, geographical information, so road density and land use, critical infrastructure, hospitals, schools, connectivity. So think about cell towers, as well as kind of the economic variables that are available and the demography, so the population. And this is really a proof of concept that was developed about 1.5 years ago. And what it came to is this. So there's two views. One is the in red, which looks at kind of the prevalence of poverty. And it's shown on a hexagon of around 5 square kilometers. So that's quite a detailed view. And then the green one shows the dimensions of poverty. So is it in schooling, in housing, in wash facilities, etc. So this was developed in 2022. We've presented it at a couple of conferences, and we have also included it in our Child Atlas. So that's also a resource that you can look at online, which is kind of contains a lot of data around children. And we're currently looking like, how can we bring this forward to start using the data in a much more advanced way, and also in our project design, etc. That's it. So yeah.
We have time for a couple of questions. Yes, in the back. If you could stand up when so we can hear you better.
Sure.
Yeah, thanks.
Regarding your onboarding of local teams on your own program infrastructure, separate standard forms. So what I initially I missed is that who is the local counterpart that can help the program officer when they need to understand, first of all, that there are standard forms, second, which standard form used, when it change the language.
Yeah, it's a really good question, and one that we're currently looking at. So what we did when we rolled out the central version of Kobo, we also included some information around the form library, and this is how you can use it. But we saw that wasn't enough, because it's not something that a lot of people kind of know about, and it's a lot. So currently it's more informal communications and mouth to mouth, and we have a community of practice. But what we are doing now is with kind of so actually yesterday the website was launched with the global indicator, so the Indicate website that I mentioned earlier, and now we're really going to do a change effort around that. So that means webinars, it means we're creating courses on our learning management system so that people that newly join the organization can also look into that. And about a month ago, we also launched the DigiGuide at Save the Children. So the DigiGuide is the tool that helps country offices with digitalization in kind of any formal way. And it also includes a section on digital data collection that kind of helps people through understanding like what are the tools that we have, what is the form library, how can we use it. So we're definitely looking at that. And in addition, we're also, or what I want to do is to reevaluate the different roles that we have at the country level, but also at the central level to understand like what are the skills that we need to add, given now that we have these digital data collection tools, given now that we're working on analytics, like how do we need to change the role descriptions even to also incorporate those skills, because it does ask something else from new officers or program officers.
Yeah, in the very back, yeah.
I think for a presentation, what would you need from donors to create a conducive environment for data innovation?
So the question was, what do you need from donors to create a conducive environment for donations?
Data innovation.
Data innovations. Yeah.
Yeah.
Good thing we were recording it.
Yeah. So I think one thing is what's really important is to have that alignment on what are the global outcome indicators that we want to achieve. So one example is in the domain of direct cash transfers, there has been kind of a multi-agency activity going on to really standardize all the outcome indicators that we're trying to achieve, but also to standardize all the tools that kind of feed into those outcomes. And I think like having those kind of frameworks helps a lot, because if you can kind of have a shared understanding of what you're trying to achieve, and I believe that there's much more space for innovation in achieving those outcomes. And I think like with data, it's definitely a learning journey, and it's something that takes much more time and much more resources than you would expect, especially in kind of doing the capacity building, the building of skills within the country offices, but also at kind of a global level. And often, if I look at my very humble fundraising experience, but also looking at kind of the project budgets that are often available, there's so much focus on delivering the impact that leaves sometimes a little bit less space for having that innovation, having that shared learning experience. So I think to call it out and really say, okay, in this project, we're allocating a bucket of funding to explore and experiment and look at the data and really start understanding like what kind of data do we need to improve the delivery of this project. I think that would be very helpful.
Yeah, we have time for one more question.
What is spatial resolution?
Sorry, can you repeat the question?
What is the spatial resolution? What does that mean?
So the question for the online team is, what is the spatial resolution?
Yeah, I need to get back to you on that one. I can share a link to the technical article that explains the details of that. Yeah.
All right. Thank you so much, Aranka.
Thanks.
All right, now we'll